The mission of the Indigent Healthcare Plan is to provide a wide variety of services to those residents in Polk County who are in poverty, who cannot afford to receive care through traditional providers and do not have insurance. The mobile unit is actually so that we can get out into the community. It's actually a mobile office on wheels. We also have a nurse in that mobile unit quite often who does routine health screenings, and those screenings are available to anybody who's in that community. And we have a worker on that unit that does eligibility determinations for the programs that are available through the Indigent Healthcare Division. And that's what he does. He brings the services to the people in the communities that often have a hard time finding transportation to get into our traditional offices. Well, we actually can do 3 health screenings on the mobile unit, which one is for blood pressure, one is for diabetes, and the other is for cholesterol. Quite often, those are diseases that people have, and if they're not going to a traditional doctor on a regular basis, they may not know they have them. And that's why they call, for instance, blood pressure is the silent killer, because people will have it, they'll have a stroke because their blood pressure gets so high, and they never even realize it until that moment that they have that stroke or need that care. Same with diabetes. People don't know that they have it. They walk around for many years quite often, don't know that they have it. All of a sudden one day they end up in the ER because their blood sugar is so out of control. So our purpose is to try and get into those communities, help those people to understand what the diseases are, what can happen as a result of having them uncontrolled, as well as checking to see if they do have them and then referring them on to an appropriate place for care. And that could be one of our community partners, it could be to the Polk HealthCare Plan, or it could be to their private physician if they have one. Often people will come to our mobile unit for that screening, and we would like them to do that. We don't want them going to the emergency department because the emergency department is the most costly care. If they can be screened and get to a primary care physician and have it taken care of at a primary care doctor's office, you're catching it hopefully earlier than if they go to the emergency room. Plus you're getting it at a better cost, so it's not going to be as costly to the community as a whole or to that person if they're getting it in their primary care physician's office. And so we want people to get the care as soon as possible. And if we're in their community, they're going to feel a little more comfortable in coming for that screening. Basically what Sam does on the mobile unit is he determines eligibility for services available through the Polk HealthCare Plan and some other services as well. Some of the things that you need to bring to be eligible for the Polk HealthCare Plan would include things like proof that you live in Polk County by 2 pieces of documentation such as rent receipt, utility receipts, a driver's license with your current address. We also ask that you bring in proof of income because our income criteria is you must be at or below 100% of the federal poverty guideline to receive services. You need to bring with you your social security card, picture ID. You must have no other insurance available to you. And then we sit down, we have that interview, we just assess your situation and determine that eligibility. Okay, once the case manager determines that you're eligible for services with the Polk HealthCare Plan, we actually have you pick from a list of providers that we're contracted with to find a medical home for you. We then attempt to help you schedule that very first doctor's appointment so you're connected as soon as your card becomes eligible. Services with our program begin the 1st and the 15th of each month, so that person may have to wait a couple days before they can actually get to the doctor, but quite often if you can call that day, you can get an appointment scheduled for as soon as your card would begin. The primary care provider gets to know you, gets to know your history, and has your previous labs, understands what your current situation is. They can work with you on a daily basis or however often they need to make sure that you're healthy and staying healthy and do those health screenings. If somebody goes to the emergency room for that care, it's much more costly. You're taxing a system, you're going to have to wait, possibly for hours, and at that time that you're in there for, say, a sore throat or a headache that you could be at your primary care for, that's taking time away from somebody else who may have a true emergency who needs to be seen. And what happens is then the hospital emergency room costs go up for everybody because we have people who are in there using it inappropriately. So we really encourage our plan members to make sure that they're seeking services through their primary care provider and making sure that they're getting the care at the appropriate level that they need. Polk County is a very large county, and it takes quite a while to get from one side to the other, and we have many rural locations where we do not have offices. So it's important to have that mobile unit trying to get out to those communities. We have right now about 10 communities that we go to on a regular basis, and I have other communities who are calling me saying, can we get the mobile unit out here maybe once a month, twice a month? So we are making an effort to try and get to some additional places, and we try and shuffle our schedule. For instance, there's a couple places we go in Lake Wales, for instance, that during the summer we don't go there because they don't have a need for us to be there. So during that time period, we try and open it up and go to another location in Polk County that does have a need. So we do try and change our schedule up often. Not so often that people don't know where we're at, however, because we do publish that out on the web so that people can find us when they need to. We do use centralized scheduling, however, so we do have all of the community call Bartow, even though you may be seen in Point Sienna or in Frostproof or way out north Kathleen or down in Brewster. We have centralized scheduling here in Bartow, so they all call the same number, so there's not multiple numbers to memorize and remember, but it's the one number, and then we can schedule you actually where it's closest to your home. Most of the people that work for the Indigent Healthcare Division have worked in or around Polk County. They're residents of the county, and they're very dedicated to what they do. They're committed to serving the clients that we serve. They're committed to making sure that residents are able to get the services they need. We try and make sure that we're meeting the needs, and most of them have quite a bit of compassion and understanding of our community resources, and what our community needs are.